Welcome back. You're watching The Globe. I'm Tshepiso Makutla. Thank you so much for joining us this evening. Medics working as interns in Uganda have announced an escalation of their strike for better pay. The interns began their industrial action on the 6th of November, but they continued to work on emergencies and support some staff on hospital wards. But a letter from the Health Ministry on Saturday has ordered all medical interns who are on strike to leave the health facilities where they are based within a week. In response, all interns in public hospitals countrywide announced that as of midnight on Sunday, they will cease all work. To get a better understanding of what is happening there, we're joined now from Uganda by journalist Suhail Mugabi. He's in the capital, Kampala. Suhail, a very good evening to you, and thank you so much for speaking to us. So we understand that the threat from the medical interns now is that of a national boycott to all government hospitals. Has that happened yet, and what do you anticipate will be the impact of this?
Okay, to cut the long story short, this is something that has been happening for quite some time, and it's not only the medical interns that are now striking, but also doctors in other different fields are also on strike, only attending to emergencies. Under their union, which is also known the Ugandan Medical Association, they came out to announce a strike. Now, for the medical interns, it's quite different. In August, the president of Uganda, Yoweri Museveni, came out and said that there would be an increment in pay for the medical interns. The medical interns have been playing a very vital role in our health system here in Uganda because they've been attending to emergencies, especially with COVID-19 and the pandemic. It has been quite a challenge for everyone. So they were to be given an increment in pay, and it was announced on 9th August. However, it has not yet been realized. The medical interns have not yet received their increment in pay. Apparently now a medical intern in Uganda earns about 750,000 Uganda shillings, approximately $200. So they were supposed to get about 2.5 million shillings, which is almost 630 US dollars. So meaning that without the payment, they are not ready to handle any more emergencies. They're also saying that they don't have enough medical gear and equipment, yet they're treating people in a very volatile state. And they're also saying that their voice needs to be heard. Today, there was also a press conference that was held by the medical interns, revealing that they will not back down. They will continue with their strike. And they also condemn the actions by the Ministry of Health of Uganda to kick them out of the hospitals, meaning that they are not going to complete their training and they won't be getting their professional qualification, which allows them to continue working as doctors in Uganda once they finish their training. So now what the ministry is saying is telling the medical interns, get out. We have another bunch of young medical interns who need training in the hospitals. So let them come in and let them handle the emergencies. We are going to pay them. Now that's where there is some back and forth, tug of war between the medical interns and the Ministry of Health in Uganda.
So would that increment have been backdated? And I imagine these are some of the things that the medical interns are also inquiring. And should they be booted out of hospitals? Would they have formal documentation saying that they've completed their training and are thus qualified?
Can you please repeat the question? I wasn't hearing.
So the increment that was promised to them, would it be backdated? And secondly, should they be booted out of hospitals, would they have formal documentation that attests to the fact that they completed their training?
So first and foremost, about the increment, they were supposed to get, which is more than 100% increment, because we appreciate what health professionals do, especially us, the patients. But then, what government said, it said that they had to wait for a supplementary budget to be passed. And the supplementary budget actually was passed. Now, after passing the supplementary budgets, the medical interns started waiting for the increment in pay to be fulfilled, which has still not happened to date. So they have been asking the ministry and also asking the authorities for when they are going to implement it. Because for them, as far as they say that with the president's order, we were supposed to see the payment coming out. But now the Ministry of Health is telling the medical interns that go to the hospitals, stop striking, we shall pay you when we get the money. Now, the medical interns don't know when the government is going to get the money. Here with me, I have a document. This document that you're seeing right here, I don't know if you're seeing it here. The words are not clear, but it comes from the Center for Health, Human Rights and Development. It's a civil society organization operating in Uganda. And they have come out to condemn the actions of the Ministry of Health to kick out the medical interns out of hospitals. And they're saying that also kicking them out is illegal because the Director General of Health Services has no right to kick out medical professionals. Another thing that they're also citing, they're saying that medical interns play a vital role because they're frontline workers in their area. Now, when you say that you don't want medical interns to be in hospital because they've been going on to strike because they want to be paid, it means who is going to handle a case or a medical case that might turn out to be present. Another thing is that industrial action in Uganda, it's legal, it's within the mandate of the law. If a person is not satisfied with anything, if a person feels that they're being abused, they have every right to take industrial action. So penalizing them for taking industrial action is within itself illegal. So now, I think this issue, foreseeing in the future, it might have to go to court. The medical interns will say that this was an unlawful dismissal.
Okay.
But then the ministry is saying that you people, we have to make sure that if you don't comply with us and don't wait, we will not.
All right, so Hal, before we run out of time, let me ask you this question. What has been the impact of the strike on ordinary citizens seeking medical services?
Given that we're in the COVID-19 pandemic era, and especially with the guidelines, the standard operating procedures, the challenge, and also the medical interns going on strike has a very, very bad impact, because it is now the health worker. Most of these people are doing their training in government hospitals, and government facilities handle ordinary people who can't afford to go for services in private hospitals because they're expensive. Now just imagine a person who cannot afford to go to a big hospital cannot get services from a government hospital where they can afford. And now with COVID-19, with cases being registered day in, day out, with medical emergencies, you really have to see that it's really affecting a lot of people. And just so to say is that the medical interns who are on strike are not only doctors. We're seeing medical officers like pharmacists, nurses, midwives. Now just imagine going to a hospital when you're due to give birth and there is no midwife. So all these medical interns play a very, very big and important role. And one thing that you should know is that Uganda is short of doctors. We don't have enough doctors. We don't have enough trained professionals to handle emergencies. So it tells you that there is a crisis in need which needs to be settled. Government needs to find a uniform ground with the medical interns and understanding.
All right, thank you so much. Suhail Mugabi, journalist there in Kampala, Uganda, pointing out that those who are striking are not just medical interns, that they are demanding not only better pay, they're also demanding that government compensate the families of doctors who've been lost through the fight against COVID-19. They're also seeking personal protective equipment and other related supplies and the stocking of hospitals with all necessary drugs.